Good afternoon, dear patients. Today we will look at a case presented in the picture, redness in the scrotal area. A man came to us who has been suffering from redness and itching in the scrotal area, as well as flaking on the scrotum for 4 years now. Accordingly, he periodically applies glucocorticosteroid creams, various types such as Advantan, Elocom, and so on. However, this does not bring him any significant relief. No examinations were performed at the dermatovenerologic dispensary where he sought help. From time to time, the ointments are changed and anti-allergic medications are prescribed, but this does not bring any significant effect. He also experiences slight sensations of burning and soreness in the scrotal area, especially when rather large cracks appear. First of all, a skin scraping from the scrotum was taken to test for fungus. A fungal culture was also performed because nowadays fungi are often not detected in scrapings in laboratories. It is necessary to use more precise cultures because lab technicians, let's say, are now losing their qualifications. Secondly, tests for allergies were taken. These include immunoglobulin E, circulating complexes, and so on. You can watch a separate video about allergy tests on our channel. However, neither fungus nor allergy was found in this patient. Accordingly, we took a small piece of skin from the scrotal area, performed a histological examination, and it turned out there was in principle a suspicion of psoriasis in the scrotal area as well. Isolated psoriasis in the scrotal area was the cause of such prolonged itching, burning, flaking, and so on. Accordingly, even with the most thorough examinations, no other rashes were found in this patient. Not on the scalp, not on the elbows, nowhere else on the body. Indeed, psoriasis affects about 2% of the population, and it often presents in atypical forms involving the glans penis, which we've already discussed on our channel, and you can watch a separate video about this on our channel, as well as the pubic area. In this case, the scrotum was affected, so how did this help? Well, first of all, antihistamines are not needed. Unfortunately, ultraviolet therapy cannot be applied to the scrotum in isolation, nor can procedures like PUV therapy, because the genital organs are considered oncologically risky. However, firstly, you can use antipsoriatic ointments such as Naphtederm, or if using hormonal ones, then Dermavit, and also those with an exfoliating effect like Lacoma C, and so on. You can also use accordingly classic psoriasis therapy such as folic acid, calcium gluconate, sodium sulfate, and so on, as well as exfoliating agents, and so on. In extreme cases, corticosteroids can be used, which is what we actually did. That is, classic psoriasis therapy was prescribed. Usually with limited forms, we don't do this, but in this case, the person was suffering and it was a very serious problem. And with therapy combining injections, ointments, and so on, about 90% of the rash is resolved. Essentially, only a few small red spots remained on the skin of the scrotum, which made the patient very happy. Therefore, whenever there is any redness, you should not ignore tests or other examinations. You shouldn't think that you can always get away with just using an ointment, especially if the ointment hasn't worked after 2 weeks. That means something else needs to be done that could help the patient.